In March of 2014 at the National Press Club, inspired by the Assistant Secretary for Health, Dr. Howard Koh, we launched a major public health initiative called 80 by 18 with the goal of achieving 80% colorectal cancer screening rates by the end of 2018. So we're very proud of what we've accomplished. We have a lot to celebrate, but at the same time, we still only have 2/3 of Americans who are up to date with screening. There's 1/3 of Americans who are still not up to date.
What inspires me the most about the 80% in every community campaign is the fact that it acknowledges that the work is not done. That after 2018, that all is not lost, that the initiative doesn't stop, the momentum is not over.
I love this transition, and I love it because really all public health is local, and especially achieving high screening rates in those areas that are underserved and under-resourced is a local challenge.
Unlike all other cancers, colorectal cancer is one of the cancers that really is preventable, treatable, and beatable, and yet many populations have not benefited from screening. So the 80% in every community really makes sure that we remember that all populations are at risk and all populations should benefit equally from technology and advances in medicine to make sure that we can eradicate this disease once and for all.
And so unless we purposefully target communities, we're going to continue to see healthcare disparities. So this campaign gets at the heart of the matter.
The 80% in every community campaign is particularly inspiring to me because of how community is defined, and it is defined very broadly.
We really have to focus on not only those communities that are doing well, that just need a couple of percent to get to 80%, but really we have to focus on those who are 60%, 50% and below to make sure that we raise them up. And that may require that we have targeted interventions or programs just for that population to do so.
I'm motivated to be a part of 80% in every community because I think it really drives home to me that I have a role to play. And it doesn't have to be in my occupation. It doesn't have to be as a part of a large organization. I can get my family screened. I can get my friends screened. I can touch the lives of individuals who I hope will prevent cancer and avoid a story that can be devastating.
For me, the campaign about 80% in every community is about involving everybody and really saying, okay, if we're all together pushing towards a similar goal, no matter what we do, we're all pushing in the same direction, then the larger impact will be a national impact.
The African proverb says, if you want to go fast, go alone. If you want to go far, go together. You know, when I think about the work of NCCRT, we're going to go very far, and that's because of our togetherness. It's because of our connectedness.
I feel so confident, so sure that this group will get it done.
Hi everyone, I'm DESIREE Berenger-Carton with the American Cancer Society, and it's my pleasure to welcome you to our show today. We are here live in Atlanta, Georgia, the home of the American Cancer Society's global headquarters, to celebrate March, which is National Colorectal Cancer Awareness Month, and to mark the second year of the 80% in every community campaign, which aims to reach and exceed colorectal cancer screening rates of 80% in communities across the nation. We have a special show lined up for you today with some exciting guests joining us live and by video. To kick us off, it is my pleasure to welcome Dr. Rich Wender, the American Cancer Society's Chief Cancer Control Officer and Chair of the National Colorectal Cancer Roundtable. Rich, thanks so much for being here.
It's absolutely great to be here. It's so exciting to have people watching around the country because those are the people who've made this happen. They're the ones who are really engaged in driving screening rates.
It is exciting. We're going to get it done. I can't believe we started this broadcast actually 5 years ago when we kicked off 80 by 18. Can you believe how far we've come, but how much more we have to do, right? We're going to talk about that today.
Yeah, it's we really have changed the nation. And here's what I believe. One of the most important things we did, 80 is the new 70. When we started, people thought 70% was a good rate. Nobody would accept 70% today.
I like that. 80 is the new 70. And you have been the champion, the ambassador for this inspiring campaign, and we're going to get to all of it today. So we are so thrilled to have you here. We know we have a lot of partners tuning in today, so welcome. Many viewers are even hosting their own watch parties. We have tons across the nation that we've been reporting. So send us your selfies. Love seeing Fight Colorectal Cancer, all those folks right here from CDC, right there in our control room. There'll be some guests. We love seeing all this. So make sure, we want to give you a shout out during the show. So simply just post those pictures and comments on social media using the hashtag 80 in every community throughout the show. We'll be able to find them and we'll hopefully feature them throughout the show. Also send in your questions for our guest. We will try to get to as many as possible. So enter them on the Q&A box on your screen. So Rich, let's talk about your thoughts and your reflections and what do you have for us 1 year after we kicked off 80 in every community?
You know, the campaign has really gotten off to a fantastic start. Dr. Janava Joseph from the CDC told me 4 years ago, she said to me, Rich, you have to be thinking what comes next after 80 by 18 is done. It was fantastic advice, and we really studied and prepared. And we recognize the key is the word community, because this campaign is something completely different. Yes, 80% is the goal, but in 80 by 18, we could average it out. High-performing communities, lower-performing communities, as long as we kept moving to 80. That's not the plan at 80 in every community. That's really meaning that we have to tackle the barriers that so many people face in communities that have poor access, low income, high uninsurance rates, cultural barriers. It means a much broader engagement is needed. But the good news is we're doing that. We have not lost any of the constituents who joined us in 80 by 18. And I'm excited to say we have whole new organizations, members, much more diverse group who's signed up because they realize they've got to get it done in their community.
We're gaining lots of momentum and it's continuing, which is important because it takes a village and we have to get everyone screened.
You know, we just launched today on the NCCRT.org website our new strategic plan, 80% in every community. There's a guide, a roadmap in there for everyone, every constituent, every stakeholder. So go on and check it out.
Awesome stuff. Awesome. All right, you're going to stick around with us, so
Sure.
Thank you for your insight because, you know, we've got a lot to talk about. We have a great show lined up for our viewers. We'll take some time to understand about the campaign's momentum and the outstanding work being done across the nation. We'll also hear about the exciting role employers and survivors are playing in our campaign. And we'll take a deep dive with the latest colorectal cancer screening data from 2018. So, Rich, remind us why, I mean, you just talked about it a little bit, but this work is so important as ever. We have to reach the underserved. We have to let them know these screenings are out there. We have to reach, you know, like you said, cultural, language barriers. There's just so many people we have to reach. And I know we're making a difference, but I know you want to continue to inspire people.
Yeah, you know, it's interesting. We've used the phrase it's as important as ever. I think it may be more important than ever. We really, as a nation, should not be tolerant of health disparities. This is an obligation. It's a moral obligation that all of us share, and it demands broad inclusiveness. There's another just basic reality. This year, we predict 148,000 people will hear the diagnosis of colorectal cancer. 53,000 people will die, the ACS estimates. And we're seeing this stunning and dramatic steady rise in the risk of colorectal cancer based on the year you were born, a so-called birth cohort effect. And we just released a new paper today showing that may even be accelerating and extending into older ages as these cohorts age. So I don't think that we've ever had a more daunting and important goal. And the evidence becoming clearer and clearer that we need to start screening younger. ACS recommends age 45. Age 50 is the absolute latest age that anyone should start screening.
And obviously family history is important.
Critical.
You have to, and, you know, talk to your doctor if you have a symptom or you see something you feel not right, go to your doctor.
You know, it's such a good point because, you know, if you're going to really listen to the family history data and recognize someone's at high risk, you can't be having that discussion at age 45. That's a discussion that needs to be had much earlier, and then we need to respond to the information when we get it.
When you say those statistics, they're alarming, so we have a lot more work to do.
We do.
Yeah. So as we said earlier, this is our 5th year hosting this broadcast, and loyal viewers may notice that we are missing one of our longtime guests, Dr. Lisa Richardson, Director of CDC's Division of Cancer Prevention and Control. Dr. Richardson is on vacation this week, but did take time to record a video. Take a look.
Hi, I'm Lisa Richardson from the CDC. It's great to be here with you for our 5th annual National Colorectal Cancer Roundtable celebration for Colorectal Cancer Awareness Month. The CDC is a founding partner of the Roundtable, and I'm glad to greet the Roundtable today to support 80% in every community. If undetected, colorectal cancer can become a killer. But it doesn't have to be this way. Screening tests find cancer early when treatment is most effective. But these tests can also find polyps that, if removed, will never become cancer. CDC is committed to supporting you. Our colorectal cancer control program works to increase screening rates among adults 50 to 75 years old by putting what works into practice. We know that between 2016 and 2018, more than 3.5 million people nationwide were up to date with colorectal cancer screening, due in part to the efforts of the Roundtable and partners across the country that are working tirelessly to save lives from this disease. Let's all continue to work together until we see 80% and higher screening rates in every community.
Thank you so much, Lisa. We're certainly missing you here today, but thank you for all your hard work. Rich, I understand you are working closely with Lisa and the whole CDC team, and I know you're working on, you mentioned a little bit about strategic plan earlier in the broadcast, but can you go more into depth?
Sure. So, this was a result of a year's worth, long work. A year-long work. It's easy for you to say. Yes, indeed. With the CDC, the ACS, but so many other stakeholders, including our steering committee from the National Colorectal Cancer Roundtable. And we really have built an interactive strategic plan. I really encourage everyone to go on the NCCRT.org website and take a look because you'll see you in there. You'll see your community in there. And it highlights the area that we have to do a better job because colorectal cancer is still the second leading cause of cancer-related death in this nation when we combine men and women. A lot of work to do.
A lot of work to do. We want to remind folks, please be sure to post your pictures on social media with the hashtag 80 in every community so we can give you a shout out live on the show. We'll also have some time to take a few questions live, so please send us those or your comments. Via the Q&A box. We're seeing them there, so please keep sending them in. We love seeing all the shout-outs and the viewing parties from all across the country. It's really great to see, so we love seeing that. We do have a comment for you, Rich. It says, we are here to support this effort across our community, states, regions, and beyond. Thank you, Dr. Wender. So we're receiving a lot of those.
Well, the thanks really goes back. The way, how you get screening rates up? One person at a time.
That's right.
It's the only way.
That's right.
It demands broad engagement of thousands and thousands, hundreds of thousands of people from every sector of life to really get these rates up.
Spread the word, like you said, one person at a time. On Monday of this week, the National Colorectal Cancer Roundtable announced its 2020 slate of 80% Every Community National Achievement Award honorees. The awards program is quite competitive. The honorees represent a diverse group of stakeholders. So I want Rich to do us the honors of our grand prize winner. Can you tell us?
I would be delighted. I'm so thrilled to announce that the grand prize winner of our 80% in Every Community National Achievement Award is the University of Alabama at Birmingham. Now,
yay, we're all clapping.
We're clapping. A lot of people know this amazing cancer center, one of the finest in the nation because of their work to reduce disparities. But guess what? They won because of their work in the employer category, increasing their screening rates in their 23,000 employees from 54% to 68% with a really innovative work. And I had the incredible pleasure and fun experience to go visit and learn more.
That's awesome. Let's take a look.
Leaders across UAB, the Cancer Center, campus, and hospital signed a pledge to increase our colorectal cancer screening rates within our employee population. UAB Employee Wellness took this pledge and ran with it. We started this campaign called Love Your Bum, Get It Screened, to try to get the message out that screening really does save lives.
You kind of began to answer my next question, is that it's not so obvious that employees are going to really get excited about getting colorectal cancer screening, but you guys managed it. How'd you do it?
I think the key that we did and really took is that you want to take a serious message but make it fun and engaging. So we've had different events that we've had a 16-foot inflatable colon. It's very interactive. People can walk through the colon and see the red carpet and really engage employees to learn more about what screening options are out there and what is a typical age to be getting screened.
Fantastic. You know, you don't become our National Achievement Grand Prize winner without real success. So tell us a little bit about the numbers. What did you achieve?
So we went from a 54% screening rate in our population to a 68% screening rate within 2016 to 2019, and that's been a huge success. But one of the biggest things that I've really enjoyed seeing is the engagement that we've seen through employees. We're seeing 400 employees that show up to our different events and are really talking about the events that we put on. We're so thankful for our partnership with the American Cancer Society. They have really helped in planning all of our events, collaborating and understanding different ways that we can reach our eligible population, and just many more ways that they've been a huge support in providing evidence-based resources for us to really be able to spread that message.
Our cancer control staff in every state in the country has just made a real difference, so I'm delighted to hear the partnership has worked here. So, you know, we would love to see every employer get behind that. What advice do you have? How can we get other organizations to engage in this way, and what would you recommend as a way to start?
Yeah, I would suggest to find champions within your community that are passionate about the colorectal cancer screening and spreading that awareness, getting experts in the field to be able to share what options there are and why screening is important, and then just finding a creative way to engage your community and bring a fun way to talk about a serious message.
I'm here with Alicia Jones, the Chief Human Resources Officer at the University of Alabama at Birmingham, who's been a real leader in this effort. So welcome, Alicia.
Thank
you.
And
what do you think it takes to really get the employees engaged around this effort, and why do you feel that's so important?
This one was a little different. So it gave us an opportunity to have a very focused campaign, have some focused, targeted messaging that really made, I think, most people stop and think that, you know, we don't hear this every day, so this must be really important. And they kind of stopped and took a look, helping to make sure the leaders understand the why behind it, why it's important. You know, if we increase screenings, while there may be an initial cost, potentially in your healthcare plan, you can then still see the benefit of people having those screenings, and it's just the right thing to do.
What would you say, and I'm sure you're with your compatriots from around the country, what can we do to really get more and more business leaders engaged?
You know, I think that, again, helping people understand the why. You know, and this is one, it is a screening that people don't tend to talk about as much and don't understand the importance. I've even had people say, well, we don't want to talk about it because, or put a focus on it because it's only for part of the population over a certain age. That's okay. We talk about maternity benefits that are only for population that's at a certain age. So it's just still important to make sure that we segment all of the important aspects of screening, services, benefits, preventive, well-being, all of the things we offer, and this just has to be one of them.
Fantastic. So let me see if I got it right. We got to make the business case.
Make the business case.
Make sure people know the why.
Yes.
And that can include the numbers, that we really can reduce death rates from colorectal cancer dramatically.
Yes.
We can save lives. That there is an ROI in preventing advanced disease.
Yes.
And that it's the right thing to do.
The right thing to do.
What's one thing you're really proud about? What would you say?
Oh, absolutely the team. It's the team that stayed on top of this and did the big things and the small things to help make sure the word got out, to make sure that our employees knew why this was important, to make sure they knew how to get the screenings, to make sure they got the educational materials they needed, that did things that were kind of funny things that some people thought, why in the world are we doing this? That really got attention and got people to come out and ask questions, people who would have never done it before. So the one thing I'm proud of is the team that made this happen, and none of this happens with any one person. So it was a full team of people that helped us get here.
We're joined now by two physicians at the O'Neill Comprehensive Cancer Center here at UAB who've been an important part of this effort to increase screening among employees. Dr. Melanie Morris, a colorectal cancer surgeon, and Dr. Nipun Reddy, a gastroenterologist. So tell me a little bit, how did you get involved? What part have the physicians played in this effort to increase screening in employees?
I think one of the main reasons I wanted to get involved in order to screen our population was, I think the first group to start with would be the UAB employees. I think that's a vital part of our organization here. So if we're not screening our own employees, how can we tell the community that we're doing a good job?
So let's talk a little bit about what did you do? How did you get the employees engaged in this?
So I think there have been a lot of different efforts. I think one thing that was really important is our social media push. So I think in the days of social media, people like to create a buzz around something. So we've had quite a few exciting events put on by our GI surgery and GI medicine staff with leading these live Facebook events, having the inflatable colon that people can walk around and see. Dunkin' Donuts has partnered with us to give people free coffee where there's a human polyp walking around. And so employees just coming into work saw this exciting buzz of what was happening and asked more questions and wanted to know more.
You know, we're striving for an 80% screening rate. I don't need to tell you how difficult that is. Tell me a little bit about how UAB has viewed that 80% goal.
Yeah, I think as you can see with supporting things like lunch and learn efforts with free lunches, as well as really focusing on education for our employees, as well as having competitive health insurance packages that will include appropriate screening options as necessary, has really allowed the UAB employees to get the screening that they need.
Fantastic. You know, physician champions make such a difference. Thank you for taking the time to talk to us today.
Thank you very much.
Thank you.
What a great story. I love that you took a road trip out there.
It's fantastic.
They're fantastic, and they made it fun and engaging. I love, love your bum, because people don't want to talk about it. You know, it's just like taboo. We're receiving a lot of comments, so congratulations to UAB. People are saying thank you for your awesome work. You're doing awesome. Keep it up. Thank you for sharing. People are asking, will the UAB video be available? I want to show it to my employer. And yes, we're going to post it to NCCRT's website next week. So, so stay tuned for that. So what is next for UAB?
Well, that's pretty straightforward. Nothing's stopping them until they hit 80%. I mean, you can see that. And I think they're really committed to also sharing this message. And you can see the pride that they really have in this work and how eager they were to share it. And they gave, again, big shout out to their American Cancer Society partner as well for, and it does take a village to get screening rates up.
We're getting some viewer questions about UAB. How did Alabama track their screening rate internally? Are most employers able to access this information through their health plan partners? Yeah, that's a good question.
They used a combined effect to do it. They did get cooperation from their health plan partner, but and they're self-insured. They have one major payer, so that makes it easier to use their health plan to track. But they also did some targeted surveys to track screening rates. So it's a very good question, though. Employers, it's very hard to improve things you can't measure. So figuring out how you're going to measure your rates vital.
All right, very good. Well, congrats again to UAB. So really exciting stuff. We also want to take a moment to recognize the remaining honorees. Our other honorees, a state-based cancer coalition, the North Dakota Colorectal Cancer Roundtable. A state policymaker representative, Fred Allen from Arkansas. A cancer center, the Dan L. Duncan Comprehensive Cancer Center at Baylor College of Medicine in Texas. A community health center, Norton Sound Health Corporation, Alaska. And a second community health center, North Hudson Community Action Corporation in New Jersey. Let's learn more about these honorees. Take a look.
We are the North Dakota Colorectal Cancer Roundtable, a statewide coalition committed to increasing the use of life-saving colorectal cancer screening. Since 2015, we have trained hundreds of health professionals, partnered with local survivors to raise awareness, and worked to reduce structural barriers to screening. Thanks to these joint efforts, more North Dakotans are getting screened for colorectal cancer, and lives are being saved. Today, we celebrate this progress, and we won't stop until we achieve 80% screening rates in every community.
My name is Fred Allen. I'm a state representative, District 30 in Little Rock, Arkansas.
I'm Michael Keck. I'm Government Relations Director for the American Cancer Society's Cancer Action Network here in Arkansas.
I was the lead sponsor on Act 655, which the governor of the state of Arkansas signed into law. It is important for me to be a part of this cancer screening because I am actually a cancer survivor, and I have had members in my family to actually die from this dreadful disease. And one of my goals is to continue to bring this disease in the forefront of all people.
The Colorectal Cancer Screening Initiative will provide more Arkansans with the opportunity to be screened for colorectal cancer. This will allow us to catch cancer earlier and be treated earlier with a better likelihood of success.
And I want to thank all the members of the General Assembly for their support and efforts in getting this bill signed into law.
This bill had support from Republicans and Democrats, rural and urban legislators, and will make a significant difference in the fight against cancer here in Arkansas.
Again, I want to thank everybody that played a major role in this, and may God continue to bless you all.
Our mission at the Dan L. Duncan Comprehensive Cancer Center is to engage the medically underserved.
Other videos, they'll be posted on social media, on NCCRT social media. So make sure you check them out. We'll have them throughout all the month. So our honorees are doing incredible work. We want to tell you a little bit more about them. Norton Sound Health Corporation, a tribally owned and operated healthcare organization, serves 20 tribes in northwestern Alaska. The organization is committed to addressing barriers to screening and has seen incredible progress. Colorectal cancer screening rates climbed from 7% in 2013 to 70.5% in 2019. It's just incredible, fantastic. And then we have North Hudson Community Action Corporation, the largest center in New Jersey, serving over 86,000 patients in a largely Hispanic community. At North Hudson, patients receive a screening recommendation at all health center visits, including dental and behavioral health. In 2018, the organization reached an 84% screening rate, surpassing the 80% goal, which is awesome. Each of these awardees are doing tremendous work. So I'm just so excited about this. And it's just incredible and encouraging and inspiring and motivating, right? All these words we want to say, and powerful and impactful, that they're doing it. And we've got to do more. And they're just giving us that extra motivation.
Yeah, it's great points. And one of the things that the diverse group of awardees illustrate is that we need multiple stakeholders. This is businesses, it's cancer centers, it's federally qualified health centers. And we've also shown for the 80% in every community that the FQHCs, taking care of uninsured, low income, Medicaid insured, when they pull together and follow evidence-based interventions, can hit 80%.
It's just incredible. We want to remind our viewers that you can send in your pictures and post. So we want to make sure you send those in, and we also want to make sure when you post, use the hashtag 80 in every community. Send in your questions for our guests. So they're all just incredible stories, and it plays a role how increasing in screening and saving lives from the disease. So make sure just continue to spread the word. All right, so we are very excited because we have a very special guest here with us today, Allison Rosen, who not only spearheaded much of Dan L. Duncan Cancer Center's work, but she's also a colorectal cancer herself. So Allison, thank you so much for being here.
Thank you so much for having me.
We so appreciate it. So the work you're doing at the Cancer Center is phenomenal, but it's also personal. Can you tell us how you found out you were diagnosed with cancer, colorectal cancer, and at what age?
In 2012, I was 32 years old, and I was having symptoms that I didn't quite understand. I was losing weight, I was severely fatigued, I was having change in my bowel habits, and of course, blood in your stool. And I had no idea, even being a cancer researcher, that this was a sign for colorectal cancer. And that same year in June, I went to my doctor, I had the screening that I needed to have, and I was diagnosed with stage 2 colorectal cancer. And I went through chemo, I went through radiation, I went through multiple surgeries, but I'm proud to say that I'm 7 years cancer-free.
Hallelujah. Congratulations being 7-year cancer-free. I mean, you really took a personal, your passion for your work and then your personal experience and really helping increase screening rates. You're really pounding the pavement, making sure that people know how important it is and listen to your body.
Yeah.
Because screening rates, right, we're telling people 45, but you were 32.
Yeah, I think that the power of story is really important. And so I had I was doing advocacy work while I was working in the cancer research lab after I got better. I was working with Fight Colorectal Cancer as an ambassador. I was working with the Colorectal Cancer Alliance as a part of their Never Too Young advisory board, and I'm the event director for the Get Your BERENGUER 5K for the Colon Cancer Coalition. So I was doing all that, and I got our cancer center involved, and they told me about on the Office of Outreach and Health Disparities, and I asked, do they have a job open? And once they told me they did, and I met with my bosses who are amazing leaders within cancer prevention world, I got to do the work. I got to start doing the work, and really it was the roundtable and the resources that they had that I brought to the team of people that I work with, because I don't do this alone. Everyone that we work with has a part in this. I have one small part, and really using the resources, I was able to use my story as well as the facts and figures to help provide training for providers and staff, along with all the other things that we do within our office to help increase the screening rate, including patient navigation, provider and staff training, a lot of community outreach and education. You were talking earlier about going out in the community. We do that. We have people that specifically target the Hispanic Latino population, the African American population, and the Vietnamese population, because they are at higher risk for colorectal cancer. And really, we're in the clinics. We work with Harris Health Systems, they're our main partner, and we're out in the community where the people are, because they don't always come to the clinics.
We are getting so many comments for you just saying, go Allison, what an amazing advocate. So thank you for, sharing your story. You're sticking around for a few minutes, but really, Rich, she's turning her passion into awareness and her personal story to make sure, she can help people right there on the ground. How important, when you think of cancer centers, you think of cancer treatments, but what role do cancer centers play in raising awareness about screening? It's important.
It's really critical, and I think there's been an increasing recognition around the country that all centers and hospitals that are committed to reducing the burden of cancer have to define their responsibility broadly. They really are responsible for the people who live around that facility. It's a population perspective. Yes, they have a financial requirement, a community benefit need that they have to meet, but it's really much more about defining your mission. And more cancer centers are doing just that. They're finding ways to do it, but not all. And some are knocking it out of the park, like Dan Duncan has done with Allison's amazing leadership. And some are just starting, and some have yet to get engaged. This is one problem that all the cancer centers should join to achieve.
So important. We're getting some more comments here for Allison. You go, Allie. You're a true voice for the cause. You're an amazing advocate. Keep up the great work. So there's really nothing like, sharing your personal story, nothing like the power of survivors to get people screened and to bring home that message. Yeah. And making sure, and you're a champion. You've been on the research side, and now, you're on the survivorship side. So, what can you tell folks to make sure they continue to spread that message?
I think getting involved in advocacy organizations in their cancer center or wherever they were treated. The patient voice and patient experience is so important. That's how I got started. We work a lot with our local chapter of ACS. They have a giant inflatable colon. We've helped turn the city blue. We've gotten proclamations. And really, I think we're out in the community spreading the awareness. And I'm doing the work for a job, but I get to do it outside of work too. But you don't have to work for a cancer center or an institution that does this. Ask them if you can do it yourselves. Ask if you can write a story about your experience. The power of sharing your story really has been life-changing for me, and I get to do this job, and it's a huge honor and privilege.
And any words of encouragement as people are going through this very tough time in their lives?
Stay positive. Stay positive. reach out and get, connect with other survivors and patients. There's online community, there's support groups, there's all, like that really saved my life. I haven't met anyone my age that had colorectal cancer when I was going through my treatment. And really, the one-on-one matching, there's so many organizations, including ACS, that do that. I talked to a perfect stranger about what I was going through in my journey, and she made me feel so comfortable. I don't remember her name, I don't remember where she was from, I don't remember anything about her except for that feeling that I wasn't alone. And I really think that there's Blue Hope Nation, there's Colon Town, there's so many groups that if you can't leave your house or you don't want to leave your house, you can get that support for a simple question like, is this normal for my chemo? And really, I think my best friends now are people within the community, people that I work with, but then also survivors and patients and caregivers, and we supply support for each other. And that support really, I really think saved me, because it's the physical as well as mental journey, and that mental part was filled with love and support from all these people that are probably commenting, because I speak for myself, but I speak for everybody. There's a lot of people that don't have a voice, and I want to make sure that they do. They have a champion that can represent them and make sure that they're not alone.
So many ups and downs through the cancer journey, and look at you now, and you're doing great. So thank you so much for being here. Rich, I mean, it's hard to top that.
Cannot be topped.
Before we say goodbye to Allison.
I want to be clear that Allison volunteers for every colorectal cancer organization in the world. Let's be, she's partnering with all of them, doing an amazing job. And we're just going to take Allison from here. We're going to take her to the American Cancer Society cloning machine, put her through. But, the amazing thing is survivors, even those diagnosed at a young age, before we recommend screening, have been our #1 champions for this campaign. And that's a real act of selflessness, of giving. And we could not get this work done without them. And Allison is simply amazing. Thank you so much.
Yes, thank you so much, Allison. We so appreciate it. You're just doing incredible work and making an impact, making a difference. So we're so happy to hear you're celebrating 7 years. So thank you for being here with us and spreading the message. We do have a few more comments. Just everyone is just so happy to see you're doing so great and spreading that message. So thank you so much. We want to remind folks and just let you know that we're having a little bit of technical difficulties. We were supposed to have this wonderful video from Sim Marshall, our CEO of the Dallas Mavericks. And it's clear that employers and survivors play such an important role in getting the message out about colorectal cancer screening. And so we will, since we can't share this live with you, and this is the beauty of a live webcast, live TV show, we will make sure that we put Sim's powerful message, the CEO of the Dallas Mavericks, on the NCCRT website, and we'll put it on social media, because we have a whole bunch of videos that partners sent in, and we'll be able to show them. But I know she has done so much work. So we were very closely involved with her, met her during when she worked for AT&T. And she did a huge colorectal cancer screening, rate within her own company, right? And so I know she's spreading that message.
Well, thanks to Sim's leadership, when she was at AT&T, they were a former National Achievement Award winner. So, and then she became the first African-American woman to be the CEO of an NBA franchise. She's changed the culture dramatically for the Dallas Mavericks. She was our wrap-up speaker at our annual meeting at the NCCRT. And she has an incredible story. She was diagnosed with colorectal cancer. She was screened at age 50, but it was age 50 and 364 days, 1 day shy of her 51st birthday. She, in retrospect, had a family history, which she just hadn't kind of paid attention to. In retrospect, had symptoms that she just didn't really pay attention to. And Sim is so authentic, so real. And illustrates both the personal aspect, know your body, pay attention to it, get screened on time, not late, know your family history and respond to it, but at the same time a business leader, an inspirational leader, really amazing.
She is incredible, and if you haven't, you won't want to miss her video. We are going to post it right after the show, actually on Twitter. It's really emotional, impactful, and as she just tells her story so beautifully. We have some more comments. Our organization, Kentucky Cancer Link, sends us out home screening kits, fit kits. Do we have data on how these kits are impacting testing rates? I
have not seen data specifically about if they're talking about a specific intervention. But what we do know is that virtually no one is hitting the 80% rate with a single modality. And this issue of choice, the best test, the one that gets done, is an absolute core principle for our 80% in every community goal. There's tests that are easy to do, affordable, available to anyone. There's a test that's right for you. So knowing all of the options, and they're all equally recommended. If they're done according to guidelines, they save the same number of lives, prevent the same number of colorectal cancer deaths. So using options is critical.
Wonderful. Another question for you real quick. How can we improve partnerships between FQHCs and gastroenterologists?
Yeah, it's a really critical question. I'd say the number one barrier that we're still facing is availability of colonoscopy. So most FQHCs are using a stool-based strategy as their main strategy, such as an annual FIT testing. But all positives must have colonoscopy, or else there's no value at all to the screen. So there's, if you go to the website, nccrt.org, we have tools available in our resource section that summarize the huge number and increasing number of evidence-based strategies to engage gastroenterologists. One of the most important things to do is to do a calculation of about how many colonoscopies will be needed in your population, and then to take that number to every available colonoscopist in the community. Don't put all the burden on one group. But if you spread the burden, the numbers come out as being very manageable, and that's really been a key. Partnering with hospitals, another really key.
Really, really great information there. And we're going to get into some data and statistics. So we've heard some really inspiring leaders about how they're working to reach colorectal cancer screening rates of 80% and higher in every community. We're going to shift some gears now to talk about how we're doing as a nation with reaching our goal. So our first panelist is Dr. Amy DeGroff, a senior health scientist and evaluation team lead at the Centers for Disease Control and Prevention. We're also joined today by Dr. Stacy Fidowa, senior principal scientist, surveillance research here at the American Cancer Society. So thank you so much, ladies. Thank you so much for joining us.
Great to be here. Thanks.
We are so excited to, learn more about this. So I understand that the data recently became available. That is the national colorectal cancer screening rate as of 2018, which is the latest year that we have the data from, right? So Amy, what does that data tell us about our progress for 2018?
Right. Well, CDC funds the Behavioral Risk Factor Surveillance Survey. We call it BERFIS because we like to use acronyms in public health. And in that survey is an annual statewide health survey that's conducted by telephone across the nation. So every 2 years, we include a set of questions that allow us to assess the national screening rate for colorectal cancer. And the last time that was done is in 2018. And the data show us that as of that year, 68.8% of Americans are up to date with screening in the age group 50 to 75.
68%.
68.8%. Okay. Don't forget the 0.8%.
Yes, it's big. Okay, almost 69%.
Right.
Yes.
And that compares to 2012 when the screening rate was 65.2%. And if you translate that a bit, it reflects that 9.3 million more Americans were screened in 2018 than in 2012. And that's really good progress and reflects the good work going on by the Roundtable and organizations around the country.
That's a good increase. That's impressive, right? Stacey, so what are you seeing in the data that you work with?
So I work with the National Health Interview Survey, and it's similar to BERFIS. I'm going to use the acronym as well. Although different from BERFIS, it's an in-home interview where people are interviewed by trained professionals about their health behaviors, including colorectal cancer screening. And in 2018, about 66 to 67% of people were up to date with colorectal cancer screening, which is up from it's up about 5 percentage points from 2013. And when we were looking at the data, kind of going back a little bit further, we noticed that the actual number of people who are eligible for screening is growing as the baby boomer population aged into screening. So between 2000 and 2018, the number of people who are up to date with colorectal cancer screening actually tripled from about 20 to 60 million. Which is really impressive.
That's exciting, right? So Rich, do you think we're on our way to reaching 80%?
There's no question we're on our way to reaching 80%. And again, there's more data when we dig deeper. But don't forget that we already have demonstrated the achievement of 80% in many types of systems, in many practices. But it demands multi-pronged intervention. So I'm confident we're on our way, but I'm also actually inspired by the fact that no one feels satisfied by the progress. Everybody's very on board to keep going.
Right, we're not going to stop. Amy, are there any populations that are reaching 80% or getting close to that goal?
Absolutely, as Rich was saying. So based on the 2018 BERFIS data, we found that among adults that are 65 to 75 years of age, 79% were up to date with screening. That's just 1 point away from that 80% mark. And within that group, there's many subgroups that have already surpassed the 80% mark. And those include women, non-Hispanic blacks, non-Hispanic whites, persons with insurance, and persons with a regular healthcare provider. And then also folks that have an educational level of some college or technical school or greater, as well as those with a household income of $35,000 or greater. So there's just a lot of real successes. And we'll probably talk about some of the gaps in a minute.
Yeah, and we are. That was my next question, you know, because it's wonderful to celebrate the successes, and it's impressive. Those numbers are impressive. But of course, I'm sure there are many groups that have lower screening rates. So where are we not seeing as much progress?
Well, let me say that the highest screening rate that was observed in that survey was 87%, and that was among adults aged 65 to 75 who have household incomes of over $75,000. Now, here's the big discrepancy. On the low end, there were only 33% of adults aged 50 to 64 who are uninsured. So that's a 54 percentage point differential that's really significant. One of the big gaps we see is in regard to age group, in fact. So as I mentioned, when you look at the data for that 65 to 75-year-old group, the rates are 79%. But when you look at that for the 50 to 64-year-old group, it's only 63%. And that's telling us that public health and our other partners really need to be focusing our efforts on that younger group. And we also see disparities and lower screening rates among persons with lower education, lower income, lack of health insurance or a regular health care provider. And in terms of race ethnicity, we see lower rates among Asian Pacific Islanders, Alaska, American Indian, Alaska Natives, and Hispanics. So those are some groups that are experiencing disparities. At CDC, I think in Lisa's video, she mentioned our colorectal cancer control program, and we're really proud of this program. We fund 30 awardees around the country to partner with primary care clinics that serve low-income populations. Many of them are FQHCs. And what they do is work with them to implement strategies that are known to be effective, there's science behind them, that will increase colorectal cancer screening rates. And to date, we've got nearly 800 clinics that have been recruited as part of this program. And those clinics serve a population of almost 1.3 million adults aged 50 to 75. So we've been able to observe over the first 3 years of the program for those clinics involved during that time, an increase in screening rates of 10.3 percentage points. We're really proud of it. Reflects the great work of our awardees and their primary care partner clinics.
Yeah, that is great. Stacey, are you seeing similar trends, progress in some areas, you know, and disparities in others?
Yeah, a lot of what we're finding is similar to what Amy has mentioned. So for example, in groups that have Medicare plus supplemental insurance, so again, those higher income earning or they had in the past, 65 and above groups have higher screening rates that are approaching 80%, as well as college-educated adults. We also saw a recent and promising increase among Hispanic and Medicaid insured populations, although their screening rates are well below the national average, although they had the biggest increase since 2015 in the recent data that we've been looking at. And like Amy has found, screening rates among people in their 50s is particularly low. And when we look at the population who we'd have to screen, who's not up to date, over half of them are in their 50s, and half of them have insurance. So that's kind of speaking to barriers beyond health insurance. A lot of these people who need screening are working-aged adults, and it's kind of going back to maybe some of those employer programs that Rich and you all talked about earlier.
And I understand there's a new publication that shares these findings.
Yes, I'm proud to be the messenger of an article led by my colleague Becky Siegel. She and a big team of people published the colorectal cancer facts and figures that's released today. And then there's more of a scientific article for clinicians or for people who are like more of a data geek, like me, in CA, the Cancer Journal for Clinicians, which is one of ACS's flagship publications. So I encourage everybody to check one of those two publications out.
Yeah, so much information in there. Rich, I mean, we've learned a lot about progress, but also where we have a long way to go. So what do you think this tells us about the direction of this campaign, 80% in every community?
Yeah, it really fully instructs where we have to give our attention. Both Stacy and Amy highlighted some of the populations who confront greater barriers to screening. But I do want to really double down on all of this information, including the Facts and Figures article that was just published, of this really alarming increase in the risk of developing colorectal cancer and the incidence of colorectal cancer for those people born more recently. We call this a birth cohort effect. And as these people are aging into their 50s or 60s, they're carrying this risk with them. For those born particularly since 1990, and the effect seems to be increasing, not decreasing. So the importance of starting screening on time cannot be overemphasized. And the task force is looking right now whether they will also switch their beginning screening age to 45, and I think the evidence are pretty compelling to do that. But in any case, the fact that the rates are so low in the 50s means that we are going to see an avoidable burden of colorectal cancer that we really need to tackle. So that's one place, and then in every community, they kind of nailed that, because that's what we're going to have to do. And communities want to own this problem, and we need them to.
We have a question coming in. When we talk about 80 in every community, how do we reconcile that Hispanic population has the lowest screening rate, but the African American population is most likely to die from colorectal cancer?
Well, I'll take the first stab at that and see if Stacey and Amy want to add to it. Disparities are very interesting. There's no one factor that contributes to a mortality disparity. Disparities result from a series of failures. So 1 is screening rate, 2 is screening quality, 3 is follow-up. If you have a positive fit, your count is screened, but if you don't get the follow-up colonoscopy, you get no benefit. It's the quality of the colonoscopy, and then it's the quality and rapidity of entry into treatment for those who need it, completing treatment. So there's no one factor that contributes to mortality disparity. It's really a series of failures. And ironically, the more we have to offer for a particular cancer, like colorectal, where we have a lot to offer, actually the greater the disparity between the high benefit populations and the lower benefit populations.
Oh my gosh, so much. Clearly we have, a lot of work to do, but we have so many great resources to support our efforts. So be sure to click on those resources tab on your screen and visit nccrt.org to download the strategic plan and other helpful tools. I know we're getting in a lot of questions, so we appreciate that. And we mentioned earlier, we couldn't get to all the videos. Make sure to check them out on Twitter, at NCCRT, on the social media pages, and also go to the website. So we are very excited that everyone keeps sending in their comments and our questions. We have another question. Can you tell us more about our incidence in younger populations? And when we had our survivor, Allison, 32 years old, diagnosed.
Yeah, I mean, I'm happy to take a quick. You want to comment on that, Stacey? Because your team's been working on that.
Yeah, and I should say that I don't lead the incidence data. Yeah. But my colleagues do. And yeah, the increase in the younger populations is one of the most rapidly increasing rates, although the absolute rates among people 20 and 30 is lower than people in their 40s and 50s. But when you look at that kind of increase, it's steeper in some of those younger populations.
And again, it's related to year of birth, so that you carry this risk with you as you age. Our new publication will illustrate the numbers. So we don't know the cause. And so one of the real urgent research questions that the nation is grappling with is to understand the cause, which may help us reverse that trend. In the meantime, screening is the best tool we have.
Yeah, that's right. Amy and Stacy, thank you so much, both of you, for joining us. Rich, any final closing thoughts? It's been an inspiring program, right? Impactful, and making sure we get that message out. Screening is important. 80 is the new 70. A lot of great messages here. Any final thoughts?
You know, it's been so gratifying to see that the thousands of organizations who really got excited about achieving the 80% goal by 2018 have stayed with this cause as we've transitioned 80% in every community. And as I said at the very beginning of the show, we have a whole new set of stakeholders who've joined us. It is going to truly take all of us to achieve it, but we just cannot rest while colorectal cancer is causing as much disease burden as it is. So let's keep going, let's keep pushing, and I'm confident we can make an incredible impact.
With our incredible partners, we are making an impact.
Absolutely.
We're all coming together. So I can't thank you enough. We've been doing this 5 years. We've got a lot more work to do, but you have re-energized us, all of our guests, all of our partners, and we are excited about what 2020 brings. So thank you so much. We appreciate it. So thank you guys, and thank you so much for joining us. We have, like we said, a lot of videos that we couldn't feature today, so make sure to go to NCCRT's social media pages, follow them, and they'll be posting them throughout the month. We are so excited that you were able to join us, our guests. Congrats to all of our awardees, and of course, Rich, it's always a pleasure to kick off this program with him. Thank you for watching and for helping us reach 80% every community, and go get screened. Spread the word. Bye, everyone.